Most people believe colon cancer comes out of nowhere. But in reality, the body usually gives warning signs long before a diagnosis is made. If you're over 50 and you've been feeling a little off, maybe dealing with digestion issues, unexplained fatigue, or changes in your bowel habits, this video could be important for you or for someone you care about. Today, I'm going to walk you through the key symptoms of colon cancer so you know what to watch for and when it's time to take action. Colon cancer begins in the large intestine, often starting as small growths called polyps. These polyps can sit quietly for years and usually cause little or no pain, which is why they often go unnoticed. Over time, some polyps can slowly become cancerous. As a tumor grows, it can interfere with digestion, cause internal bleeding, partially block the bowel, and even drain energy and nutrients from the body. That's why early symptoms are often subtle. They're easy to dismiss as normal aging or everyday digestive trouble, but understanding these signs early can make a very real difference. Before we get into the symptoms, tell me in the comments where you're watching from, and if you'd like a simple health guide covering symptoms, early warning signs, and foods, vegetables, herbs, and drinks that support colon health, type "guide" in the comments. Now, let's get into the signs you should never ignore. Symptom 1. Persistent changes in bowel habits. One of the earliest and most common warning signs of colon cancer is a change in your normal bowel habits that doesn't go away. And I want to emphasize the word normal because everyone's body is different. What matters is a change from what's normal for you. It's completely normal to have occasional constipation or diarrhea. Travel, stress, medications, dehydration, or certain foods can all cause temporary changes. But when you start noticing that your bowel habits have shifted and they stay that way for 2 weeks or longer, that's when it becomes important to pay attention. For example, you may find yourself constipated more often than you used to, even though you're eating the same foods and drinking the same amount of water. Or you may experience frequent diarrhea that keeps coming back without a clear reason. Some people also notice their stools becoming narrower or thinner than usual, sometimes described as pencil-shaped. From a medical standpoint, this can happen because a growth inside the colon begins to interfere with how stool moves through the intestine. The colon's job is to absorb water and move waste along smoothly. When something disrupts that process, whether through inflammation or a developing tumor, the rhythm changes. That's why bowel habits can shift gradually rather than suddenly. What's important to understand is that these changes are often painless, which is why many people ignore them or assume it's just part of aging. But aging alone does not typically cause long-lasting changes in bowel function. Persistence is the key signal here. If your bowel habits have clearly changed and your body is not returning to its usual pattern, that's your cue to speak with a healthcare provider. Early evaluation can make a very real difference. Symptom 2. Blood in the stool or rectal bleeding. This is one symptom people often hesitate to talk about, but it's also one of the most important to understand. Seeing blood when you use the bathroom can be alarming, and many people hope it's nothing serious. Sometimes it isn't, but sometimes it is, and that's why it deserves careful attention. Blood related to colon cancer doesn't always look the same. It can appear as bright red blood on the toilet paper or in the toilet bowl, but it can also show up as darker, almost black stools. In some cases, the blood isn't visible at all and is only detected through lab tests. The appearance depends on where the bleeding is happening in the colon and how long the blood has been in the digestive tract. From a medical perspective, colon tumors can bleed slowly over time. This bleeding is often painless, which makes it easy to dismiss or confuse with hemorrhoids or minor irritation. Hemorrhoids are common, especially as we age, but they usually cause bleeding that comes and goes and is often linked to straining. Bleeding from inside the colon, on the other hand, may be more persistent or unexplained. Another reason this symptom is taken seriously is that slow, ongoing blood loss can lead to iron deficiency and anemia without you realizing it. You may not feel pain, but your body is quietly losing blood over time. The key message here is consistency and repetition. If you notice blood more than once, if it keeps coming back, or if your stools are darker than usual without a clear reason, it's important to have it evaluated. This doesn't mean you have cancer, but it does mean your body is asking for a closer look. Early testing can identify the cause. If something serious is developing, catching it early can make treatment far more effective. Symptom 3. Ongoing abdominal discomfort or pain. Most of us experience stomach discomfort from time to time. Gas, bloating, or mild cramping can happen after a heavy meal, a new food, or even stress. What's important here is not occasional discomfort, but abdominal pain or discomfort that becomes frequent, persistent, or unexplained. With colon cancer, the discomfort is often described as a dull ache, cramping, pressure, or a constant feeling of fullness in the abdomen. It may come and go at first, which makes it easy to ignore, but over time, it can become more regular. Some people notice the discomfort more after eating, while others feel it throughout the day. From a medical standpoint, this happens because a growing tumor can irritate the lining of the colon or partially block the passage of stool. When the colon has to work harder to move waste along, it can cause cramping and pressure. As gas builds up behind a narrowed area, bloating and discomfort can increase. What makes this symptom tricky is that it doesn't always feel severe. It's often not sharp pain, and it doesn't always stop you from going about your day. That's why many people chalk it up to just digestion or getting older. But aging alone does not usually cause ongoing abdominal discomfort that keeps returning without a clear trigger. If you notice that abdominal discomfort is becoming a regular part of your life, especially if it's new for you or paired with other changes like bowel habit shifts or fatigue, it's important to talk to a healthcare provider. Persistent abdominal discomfort is your body's way of signaling that something isn't functioning as smoothly as it should. Symptom 4. Feeling like you don't fully empty your bowels. This symptom can be subtle, and because it's uncomfortable to talk about, many people keep it to themselves. But it's an important one to understand. You may go to the bathroom, finish a bowel movement, and still feel like something is left behind. There may be a lingering sense of pressure, fullness, or the urge to go again shortly afterward. Occasionally, this can happen if you're constipated or dehydrated. But when this feeling becomes frequent, especially if it's new for you, it deserves attention. Many people describe it as never quite feeling done, even though they've just used the restroom. From a medical standpoint, this can occur when something inside the colon is partially blocking the passage of stool. A growth or narrowing in the colon can prevent stool from moving through normally, making it feel as though the bowel hasn't fully emptied. The colon senses that something is still there and continues to send signals that trigger the urge to go. What makes this symptom easy to overlook is that it doesn't usually come with pain. People often assume it's part of constipation, stress, or aging. But aging by itself does not typically cause a constant sensation of incomplete bowel movements. If this feeling keeps happening, especially along with changes in bowel habits, abdominal discomfort, or fatigue, it's important to bring it up with a healthcare provider. Paying attention to these signals early can help identify problems before they become more serious. Symptom 5. Unexplained fatigue or ongoing weakness. Feeling tired once in a while is a normal part of life, especially as we get older. A busy day, poor sleep, or stress can all leave you feeling worn out. What we're talking about here is a different kind of fatigue, the kind that lingers even when you're resting and taking care of yourself. With colon cancer, fatigue often develops gradually. You may notice that tasks that used to feel easy, like walking, household chores, or running errands, now leave you feeling unusually drained. You might find yourself needing to sit down more often or feeling low on energy throughout the day, even after a good night's sleep. From a medical standpoint, this type of fatigue can happen because colon cancer may cause slow, ongoing blood loss inside the digestive tract. Over time, this can lower iron levels and reduce the number of healthy red blood cells in the body. When that happens, your blood carries less oxygen, and your muscles and organs simply don't have the energy they need to function at their best. What makes this symptom easy to miss is that it doesn't usually come with pain. Many people assume they're just getting older or that their energy naturally declines with age. But while energy levels may change somewhat over time, persistent and unexplained fatigue is not something to ignore. If you've been feeling unusually tired for weeks, especially if it's new for you or combined with other symptoms like changes in bowel habits or shortness of breath, it's important to talk with a healthcare provider. Sometimes a simple blood test can reveal what's going on, and addressing the cause early can make a meaningful difference. Symptom 6. Unintentional weight loss. Losing weight can be a positive thing when it's intentional, such as when you're eating differently, moving more, fasting, or using weight loss medications under medical guidance. What we're talking about here is weight loss that happens without you trying. With colon cancer, weight loss often occurs quietly. You may notice your clothes fitting looser or the number on the scale dropping even though you're eating the same foods and following your usual routine. Some people don't even realize they're losing weight until someone else points it out. From a medical standpoint, this can happen for a few reasons. Cancer can change how the body uses energy and absorbs nutrients. It can also reduce appetite or create ongoing inflammation that causes the body to burn more calories than usual. Over time, this leads to weight loss that doesn't have an obvious explanation. As a general guideline, losing about 5 to 10% of your body weight over 1 to 2 months without changes in diet or activity is considered significant and worth checking out. For example, losing 10 to 15 pounds without trying should raise a question, especially after age 50. What makes this symptom tricky is that it doesn't feel painful or urgent. Some people even welcome the weight loss at first. But sudden, unexplained weight loss is the body's way of signaling that something may be wrong beneath the surface. If you notice ongoing weight loss while eating normally and living the same lifestyle, it's important to bring it up with your healthcare provider. Identifying the cause early allows problems to be addressed before they progress. Symptom 7. Low iron levels or anemia without a clear cause. This is a symptom that many people don't feel right away and often discover during routine blood work. Your doctor may tell you that your iron levels are low or that you're anemic, even though you haven't noticed anything obvious going on. Iron plays an important role in carrying oxygen through your blood. When iron levels drop, your body may feel weaker, more tired, or short of breath, but sometimes there are no clear symptoms at first. In adults over 50, low iron levels are taken seriously because they're not usually caused by diet alone. From a medical standpoint, colon cancer can cause slow, hidden bleeding inside the digestive tract. This blood loss may be so gradual that you never see blood in your stool, yet over time, it steadily lowers iron levels. That's why anemia can be one of the earliest clues that something is happening inside the colon. What's especially important to understand is that taking iron supplements may not fully correct the problem if the underlying cause isn't addressed. When iron levels stay low despite treatment, doctors often look deeper to find the source of the blood loss. If you're told you have low iron or anemia without a clear explanation, especially if it's new, it's important to follow through with further testing. Identifying the cause early can lead to timely treatment and significantly better outcomes. If there's one thing I want you to take away from this video, it's this. Colon cancer often gives warning signs, and your body usually speaks up long before a diagnosis is made. The key is noticing changes, paying attention to patterns, and not dismissing symptoms just because they're painless or seem easy to explain away. Not every symptom we talked about means cancer. Many of these issues can have simpler causes. But when symptoms are persistent, unexplained, or new for you, they deserve a conversation with a healthcare provider. Early evaluation can make a real difference, and in many cases, it can be life-saving. If you found this video helpful, please consider subscribing to the channel. We focus on clear, practical health education for adults over 50 so you can understand your body and make informed decisions with confidence. And if you're interested in supporting your health proactively, be sure to check the first comment, where I've shared a link to our new health guide on powerful, lesser-known vegetables that help reduce inflammation, support immune function, and protect your cells. As always, this video is for educational purposes only and is not a substitute for medical advice. If you have symptoms or concerns, please speak with a qualified healthcare professional.